Welcome to a new episode of Your Daily Health Doctor. If you're an older man, there's a conversation you've probably had with yourself countless times, perhaps even worried about in secret. It's about a very private, often unspoken aspect of men's health, masturbation in your senior years. Have you ever found yourself wondering if this practice truly serves your well-being as you age, or if there might be some invisible harm you're unknowingly inflicting? If those thoughts resonate, then know this. You are absolutely not alone in these silent inquiries. This isn't just a simple query. It's a topic shrouded in pervasive confusion, weighed down by outdated myths, and plagued by a striking absence of clear, trustworthy information. Indeed, it stands as one of the most widespread, yet deeply private concerns among men navigating their mature years. And looking at the available data, the uncertainty is palpable. Studies reveal that while a significant majority of men over 60 continue to engage in self-pleasure, many do so feeling their way in the dark, truly unsure of its profound effects on everything from their hormones to their prostate health or even their confidence and performance with a partner. That's precisely why today we're cutting through the noise to have an honest, candid, and scientifically grounded conversation. I'm going to reveal 10 genuinely surprising benefits of masturbation during maturity, followed by 10 crucial potential risks you must understand to ensure your personal practice remains genuinely healthy and beneficial. Stick around, because gaining this clarity could fundamentally shift your perspective and enhance your overall well-being. Before we get into it, if you're new here or a regular viewer who hasn't yet, please subscribe and turn on notifications. Your support helps us bring you direct, reliable health information. And now, let's start with the truly positive revelations first. Firstly, one significant advantage for men over 50 lies in actively maintaining penile health. When an erection is achieved, there's a powerful surge of blood flow into the spongy tissues of the penis, specifically the corpora cavernosa. This physiological response can genuinely be considered a form of regular physical therapy for the male organ. Consistent engagement through this process helps to meticulously preserve tissue elasticity, a quality absolutely crucial for successfully achieving and, more importantly, sustaining a firm erection as the years progress. Conversely, when the frequency of erections declines, whether due to a lack of a regular partner or a general dip in libido, these critical tissues can regrettably begin to lose their essential flexibility and become noticeably less responsive over time. In this context, masturbation offers a practical and accessible pathway to consistently uphold this vital blood flow, thus ensuring the penile tissues remain robustly healthy and capable of expanding effectively whenever required, thereby significantly diminishing the potential risk of fibrosis and undesirable tissue hardening. Delving deeper, another profoundly important advantage, robustly supported by extensive scientific research, is the promotion of prostate health. Numerous large-scale studies, including a landmark investigation conducted by Harvard University, have unequivocally established a compelling link between a higher frequency of ejaculation and a remarkably lower risk of developing prostate cancer. The prevailing and widely accepted scientific theory behind this significant correlation posits that regular ejaculation actively aids in cleansing or flushing out potentially detrimental substances and accumulated old secretions directly from the intricate network of prostate ducts. You can visualize these ducts much like a series of tiny essential tubes that benefit immensely from periodic rinsing, preventing the insidious buildup of undesirable deposits. Without this regular clearance, such accumulation could unfortunately lead to chronic inflammation or unwelcome cellular changes, which over time might sadly develop into cancerous conditions. Beyond immediate physical health, engaging the pelvic floor muscles is a notable benefit. During the culmination of orgasm, a series of involuntary rhythmic contractions occur throughout the pelvic region. These powerful contractions actively engage and provide crucial exercise to key muscles of the pelvic floor, most notably the pubococcygeus muscle. Possessing a strong and well-toned pelvic floor is fundamentally vital for a myriad of essential bodily functions, It plays a critical role in offering robust support for both the bladder and the intestines, and is moreover deeply integral to effective erectile function by expertly helping to trap blood within the penile tissues. Furthermore, a strong pelvic floor significantly contributes to maintaining ejaculatory control and proactively preventing urinary incontinence, an increasingly prevalent concern among aging men. In essence, orgasm can be truly considered a completely natural and highly effective regimen of Kegel exercises that reliably maintains the strength and inherent tone of these absolutely essential muscular structures. In our increasingly high-stress modern world, the natural reduction of the stress hormone cortisol represents an invaluable built-in advantage. Research has consistently demonstrated that the profound physiological release experienced during orgasm leads to a truly significant and beneficial drop in circulating cortisol levels. Cortisol, widely known as the primary stress hormone, when chronically elevated due to ongoing stress, can unfortunately precipitate a wide array of detrimental health problems. These include, but are not limited to, persistently high blood pressure, unwelcome weight gain, a compromised and weakened immune system, and pervasive anxiety. By providing a natural and remarkably effective mechanism for consistently lowering these undesirable cortisol levels, masturbation stands as an exceptional tool for holistic stress management, ultimately making a considerable contribution to enhanced cardiovascular health and a profound sense of overall mental well-being. Furthermore, a powerful internal chemical process involves the release of a remarkable cocktail of feel-good neurochemicals. Orgasm spectacularly floods the brain with a potent and highly beneficial mixture of biochemicals that collectively work to intensely enhance feelings of satisfaction and profound contentment. The most prominent and widely recognized of these powerful neurochemicals is undoubtedly dopamine, a crucial neurotransmitter intrinsically linked with sensations of motivation, pure pleasure, and the reward system of the brain. Additionally, oxytocin, affectionately termed the love hormone or bonding hormone, is generously released, which further promotes deeply positive feelings of closeness and interpersonal connection. This completely natural, self-generated mood booster reliably delivers a powerful sense of enduring well-being, pervasive calm, and deep contentment, qualities that are profoundly invaluable for sustaining robust mental health, especially in proactively combating debilitating feelings of loneliness or persistent depression that can regrettably arise with the natural process of aging. Beyond psychological comfort, this personal practice significantly aids in the crucial self-detection of potential physical issues. The routine engagement in self-pleasure naturally fosters a deep and intimate familiarity with one's own unique anatomy. This consistent and regular self-examination emerges as one of the most remarkably effective methods through which men can often first discover the very early, subtle signs of various concerning conditions. These might include, but are not limited to, conditions like testicular cancer, insidious penile fibrosis, bothersome Peyronie's disease, or indeed any other potentially problematic abnormalities, such as suspicious lumps, unexplained swelling, or even subtle skin changes that might otherwise go completely unnoticed in daily life. Possessing a clear and intimate understanding of what constitutes normal for your own body makes it immensely easier to promptly identify any even slight or seemingly minor changes at a crucial early stage, thereby profoundly increasing the chances of successful diagnosis and ultimately effective treatment. Moreover, the process actively contributes to improving overall sleep quality. Following the deeply relaxing experience of orgasm, there is a pronounced and beneficial release of specific hormones, particularly oxytocin and prolactin. When this release is coupled with the observed reduction in cortisol levels, it collectively generates a potent, naturally sedative effect on the body and mind. This exquisite hormonal cocktail actively encourages the body to relax deeply and profoundly, thereby making it considerably easier to seamlessly transition into a deep, uninterrupted, and truly restorative phase of sleep. A much-needed commodity that often regrettably becomes more challenging to attain with advancing age. For men who regularly grapple with frustrating insomnia or general difficulty falling asleep and staying asleep, this can represent a completely natural, highly effective, and drug-free pathway to consistently acquire the essential rest their body and mind vitally require without reliance on medication. Further expanding on physiological benefits, engaging in self-pleasure actively enhances overall pelvic blood circulation, extending well beyond just the penis itself. Masturbation notably improves systemic blood flow throughout the entire pelvic region. This comprehensive boost in circulation proves highly beneficial for the optimal health of the bladder, the prostate gland, and all the vital surrounding muscular structures within the pelvis. Robust and efficient circulation fundamentally ensures that ample oxygen and critical nutrients are consistently and effectively delivered to all tissues, while simultaneously guaranteeing that metabolic waste products are promptly and efficiently removed from the area. This holistic circulatory improvement can actively help prevent a variety of issues often associated with stagnation and compromised circulation, problems which frequently contribute to a diverse range of urinary and reproductive challenges commonly experienced by older men. A lesser-known but incredibly valuable aspect is serving as an effective training method for ejaculatory control. For men who regrettably struggle with the frustrating issue of premature ejaculation, the private and safe setting provided by masturbation offers an unparalleled opportunity to diligently practice specific techniques, such as the highly effective stop-start method. This focused practice allows an individual to gain a far deeper and more intuitive understanding of their body's unique signals and to accurately recognize that critical point of no return just before ejaculation. By consciously practicing approaching orgasm and then intentionally pausing, men can progressively cultivate greater overall control over their ejaculatory process. This learned control can then be confidently applied and successfully replicated in intimate settings with a partner, ultimately leading to a more extended, more satisfying, and mutually rewarding sexual experience for both individuals involved. Finally, this practice plays a crucial role in keeping sexual desire and the associated neural pathways actively engaged and robust. It's often said that the brain itself is our largest and most powerful sex organ. By regularly engaging in imaginative sexual fantasy and deliberate physical stimulation, you are actively and powerfully maintaining the intricate neural circuits fundamentally associated with sexual desire and physiological arousal. This consistent engagement proves instrumental in maintaining a healthy, vibrant libido and preserving overall sexual responsiveness, even in circumstances where a regular sexual partner may not be present. Much like any other complex skill or muscle, if you neglect to use it, there is an inherent risk of losing it. Keeping these crucial pathways consistently active diligently ensures that your inherent sexuality robustly remains a vital, integrated, and satisfying part of who you are as you gracefully age. However, to truly gain a complete and balanced understanding, we cannot simply focus exclusively on the positive aspects. A genuinely healthy practice is always a consciously informed practice. Therefore, it is imperative that we now thoroughly discuss 10 crucial potential risks or negative effects of masturbation that you absolutely need to be fully aware of and proactively avoid. One significant risk is the potential for social isolation. This concerning issue arises specifically when self-pleasure ceases to be a complementary component of an otherwise healthy and integrated sexual life, and instead sadly morphs into a dominant substitute for genuine human connection and interaction. If you notice yourself increasingly preferring to remain isolated at home to masturbate rather than actively engaging socially by going out with friends, participating in community events, or dedicating quality time with family, this could indeed serve as a concerning red flag. The fundamental solution here lies in heightened self-awareness. It's vital to ensure that this particular practice genuinely complements your overall life, enriching it rather than enabling you to gradually withdraw from the essential fabric of social existence. It should function purely as an addition to your life's richness, never a solitary substitute. A more physical concern involves the possibility of skin microlesions. These tiny, often imperceptible tears in the skin typically occur when masturbation is performed with excessive force, too aggressively or critically, without the provision of adequate lubrication. These microscopic lesions, which may often not be immediately visible to the naked eye, can lead to irritating discomfort, unwanted inflammation, and, concerningly, can even serve as an inviting gateway for potential bacterial or fungal infections to take hold. The straightforward remedy to this particular issue is beautifully simple. Always engage with extreme gentleness and make it an absolute habit to consistently use a high-quality, body-safe, water-based lubricant. Your body, as an incredible vessel, undeniably deserves diligent care and utmost respect. Furthermore, there is a risk of desensitization. If you consistently stimulate yourself using precisely the same method, applying the exact same pressure, and adhering to the identical rhythm every single time you masturbate, your brain's neurological pathways can, over time, become rigidly conditioned to recognize and respond solely to that extremely specific type of touch. This conditioning can subsequently create a frustrating difficulty in achieving arousal or experiencing orgasm effectively with a sexual partner, primarily because their unique touch and technique will inherently differ from your accustomed solitary practice. The crucial antidote to this lies in embracing variety. Intentionally vary your technique, consciously alter your rhythm, and consciously shift your focus during self-pleasure. Try using your other hand, or experiment with diverse pressures and varying speeds. This deliberate diversification ensures that your nervous system remains broadly responsive and acutely sensitive to a wide spectrum of tactile stimuli, promoting overall sexual flexibility. A more insidious problem can be masking underlying causes of erectile dysfunction. If you discover that you are consistently able to achieve and maintain an erection effortlessly during masturbation, yet paradoxically struggle to do so with a sexual partner, it might be tempting, yet ultimately unhelpful, to simply ignore the discrepancy. However, persistently overlooking this pattern can tragically mask the presence of genuinely serious underlying health problems that require immediate medical attention. These could potentially include critical conditions such as cardiovascular disease, undiagnosed diabetes, or significant hormonal imbalances that profoundly impact erectile function. Often, the experience of erectile dysfunction occurring specifically in the context of partnered sex serves as an early, crucial warning sign of an emergent vascular problem throughout the body. If you notice this particular and persistent pattern, it is absolutely essential to promptly consult a medical professional for a comprehensive and thorough health checkup to conclusively rule out any severe underlying medical conditions that warrant urgent intervention. Consider, too, the physical impact of nerve compression stemming from poor posture. Many men regrettably masturbate while situated in an uncomfortable or hard chair or in a hunched-over position, both of which can lead to direct compression of the crucial pudendal nerve located within the delicate pelvic region. Over an extended period, this repetitive and sustained pressure can unfortunately culminate in uncomfortable genital numbness or the development of chronic persistent pelvic pain. The ergonomically ideal position for self-pleasure is to practice in a truly relaxed and genuinely comfortable posture, such as thoughtfully lying down with proper physical support, which effectively eliminates undue pressure from this remarkably sensitive and vulnerable area, promoting both comfort and health. An unhealthy emotional escape mechanism also presents a considerable risk. Relying on masturbation as your exclusive or primary coping mechanism for dealing with overwhelming stress, pervasive boredom, or intense frustration can regrettably lead to the formation of a behavioral dependency that detracts from holistic emotional health. It is fundamentally crucial to cultivate a diverse and robust toolkit of strategies for effectively managing your wide range of emotions. This comprehensive toolkit should actively include constructive outlets such as engaging in regular physical exercise, practicing mindfulness or meditation, fostering meaningful conversations with trusted friends or family members, and passionately pursuing engaging hobbies that provide personal fulfillment. When masturbation is experienced as a conscious, deliberate choice rather than a compelling, urgent necessity, it comfortably retains its rightful and beneficial place as a healthy and enriching component of your overall life and well-being. Moreover, persistent feelings of guilt and shame are a real concern for many. Historically, many men were raised within cultural or religious frameworks that instilled deeply powerful taboos and pervasive negativity surrounding the practice of self-pleasure. If these deeply ingrained feelings of guilt and shame unfortunately persist into adulthood and cause you significant emotional distress, it can prove to be incredibly liberating and beneficial to seek the compassionate guidance of a sex-positive therapist or a trained counselor. These professionals can expertly help you reframe this natural human practice in a far healthier, more accepting, and profoundly positive psychological light. And successfully releasing this burdensome emotional weight can be an enormously liberating experience, contributing significantly to inner peace. While infrequent ejaculation has been linked as a risk factor for prostate issues, excessively frequent ejaculation, specifically multiple times a day over an extended period, can sometimes, conversely, lead to a noticeable feeling of heaviness or an uncomfortable aching sensation in the testicles and the broader pelvic area. This phenomenon is largely thought to be caused by the temporary congestion of blood vessels and the accumulation of fluid within these delicate tissues. The sensible resolution here lies in embracing moderation and listening intently to your body's subtle signals. If you experience any pain, discomfort, or an enduring sensation of fullness, it is a clear indicator that your body needs a period of rest and recuperation. The potential impact on semen quality is a pertinent consideration, though specifically relevant only if you and a partner are actively trying to conceive. While it is unequivocally important to note that daily ejaculation does not inherently harm your long-term fertility or permanently reduce sperm count, it can, however, temporarily decrease the concentration of sperm present in each individual ejaculate. For optimal semen quality during conception attempts, scientific studies robustly suggest that a strategic abstinence period of approximately 2 to 5 days prior to intercourse or sperm collection is ideal. This short period allows for the highest possible sperm concentration to accumulate, thus maximizing the chances of successful conception. Finally, a more subtle, yet significant risk is disconnection from reality, often profoundly linked to the heavy consumption of pornography. If the act of masturbation becomes overly reliant on, or inextricably tied to, the exclusive use of extreme, highly unrealistic, or highly specific forms of pornography, it can dangerously skew your expectations about real-world intimacy and make it profoundly challenging to genuinely connect with a flesh and blood partner in a meaningful way. The nuances and complexities of real-life intimacy may unfortunately begin to seem dull or inadequate in comparison to the often hyperbolic scenarios depicted in pornography. The critical key here is to thoughtfully balance any use of visual aids with the vibrant richness of your own inherent imagination and cherished memories of truly meaningful real-life experiences. Visual material should ideally serve to tastefully enhance and broaden your imagination, rather than seeking to completely replace it as the sole source of sexual stimulation and fantasy. As you can clearly see, masturbation in men over the age of 60 isn't simply a matter of being universally good or definitively bad. Instead, it is, in essence, a sophisticated tool, and much like any tool in existence, its ultimate effect and outcome are largely determined by how skillfully, thoughtfully, and appropriately you choose to utilize it. The secret ingredient that profoundly elevates this practice is always consciousness and thoughtful awareness. When approached and engaged with genuine self-awareness, deep respect for the incredible capacities of your own body, and in appropriate moderation, it can indeed blossom into a powerful, genuinely marvelous, and consistently beneficial ally for your comprehensive health, unwavering vitality, and enduring overall well-being. I sincerely hope this thorough conversation has been enlightening and truly helpful for you. I would genuinely appreciate hearing your thoughts and reactions. What particular point was the most surprising or impactful for you today? Please feel free to share your perspectives in the comments section below. Let's collaboratively continue this vitally important discussion together, fostering an environment of shared knowledge and understanding. If you found significant value and insight in this video, please consider giving it a like and generously subscribing for more direct, impeccably well-researched, and empowering health advice specifically tailored for mature health. And certainly, don't forget to activate that notification bell so you won't miss our very next vital conversation. Stay healthy, and I eagerly look forward to seeing you in the next episode of Your Daily Health Doctor.